Well, good morning. My name is Dr. Walter Tsou. I'm a fellow here at the College of Physicians of Philadelphia and on the steering committee of the section of public health here at the college. And on behalf of Dr. George Wallwright, who is the director and CEO of the College of Physicians, welcome. Welcome to the oldest honorary medical society in America. Today we'll be examining a very timely and important issue for Pennsylvania, the health effects of shale gas drilling or fracking. For proponents of shale gas drilling, it is a ticket for American energy independence and the creator of jobs for the next decade. And for opponents, shale gas drilling is an unconventional and unsafe process with significant environmental and public health concerns that has affected the health of many people. It's the latter issue that we wish to explore with today's symposium, which is likely to raise more questions than answers. Today's format begins with a presentation from Drs. Michelle Bamberger and Robert Oswald, who've graciously traveled here from Ithaca, New York, to discuss the impacts of gas drilling on human and animal health, one of the few peer-reviewed journal articles on this topic. Their bios are in your program. Following their talk, we will have a break, and then Diane Schraub, who is the principal of Schraub Consulting, which advises grant makers about environmental issues, will lead a panel discussion with two distinguished Pennsylvania speakers. Dr. David Carey and Raina Ripple work directly in the Marcellus Shale region. I will let her introduce them later to you. And then we'll have a time for questions and answers after their presentations. I want to acknowledge that this program would not exist without the support of the Clinial Foundation, in particular Andrea Redding, the Delaware Valley grant makers, Ashley Foyer Edwards and Teresa Jackson, and the College of Physicians of Philadelphia, Tina Williams and Jackie Bowman and Dr. Bob Schrar. I want to remind you that breakfast in this program is complimentary because of our sponsors. We should give them a round of applause. There are many physician groups, including the college, Philadelphia County Medical Society, and Philadelphia Physicians for Social Responsibility, environmental groups like Protecting Our Waters, Sierra Club, Clean Air Council, and Environment, and so on. The media and industry groups who are here today. Thank you so much for coming here today. We have a long and hopefully exciting program for you. And with that, I'd like to bring up Drs. Michelle Bamberger and Robert Oswald, who will be speaking on the impacts of gas drilling on human and animal health.
Good morning. This works good. I can't stand at a podium. I spend most of my time teaching in front of blackboards, so I can't. It feels confined in front of a podium, so I'll use this loud microphone instead. I'd like to thank Walter for inviting us today and all the sponsors who made this possible. I think it's particularly appropriate to be in a place like the College of Physicians to talk about this topic because of the long history of the College of Physicians in protecting public health, and that's what we're talking about today. What we'd like to do is go through some of our work that we've done on the impacts of shale gas drilling on human and animal health. And the way we usually do this, I give a brief introduction, then Michelle talks. She actually does most of the interesting things, talks about most of the interesting things, and then I come back and talk a little bit about policy at the end. The way I like to start this usually is with this statement that we hear from industry quite a bit. Since it was used for the first time in the 1940s, hydraulic fracturing of a natural gas well has never been proven to contaminate drinking water. There's a lot in that statement. First of all, what do they mean by proven? And we'll talk more about that. But most importantly, is this statement even true? Which I sincerely doubt. And even more important, does this statement really matter? And what I mean by that is that when they're talking about hydraulic fracturing, they're talking about one specific portion of a large process. Well, when we talk about that, we're talking about a life cycle process. We're talking about starting in drilling. Actually, we're starting before the drilling even. We're talking about bringing the raw materials together, silica mining, etc. We're talking about the hydraulic fracturing process. We're talking about trucking. We're talking about impoundment ponds, condensate tanks, and pipelines. And perhaps, maybe even the most important issue is what happens to those wells in 5 years, 10 years, 50 years, 100 years. We know from industry studies that up to 50% and maybe 100% of these wells eventually fail. So these are important issues. We want to think about the entire life cycle. But right now, Michelle is going to talk about the health impacts.
Is this on, everybody? Great. Okay, so we are studying the health of animals living nearby gas drilling operations, not only to try to figure out what's happening to them, but what might happen to us. Because animals, especially livestock, are on site constantly, their exposure rate is going to be much higher than ours. Their exposure rate to contaminants in the air, water, and soil is going to be much higher. And because their breeding rates are higher, and their generation times are shorter, we are much more likely to see health impacts in animals first before we see them ourselves. Having said that, we're continuing to document cases. And as we pick up more cases, we are picking up households with children in them. And what we are seeing is that in those households with children, it is often the children who become ill first. Now, why should that be? When you think about it, children have higher exposure rates to contaminants than adults do for a few reasons. One is they eat more food than we do per pound of body weight. The second thing is their metabolic rate is higher. We'll be getting back to food safety in just a little bit. Okay, so when we thought about how can we study health, we chose to do case reports, or what's known as case studies. So let's talk about what case studies can and can't do. They can't give us prevalence data. So in other words, they can't tell us how common drilling-related health problems are. They can't give us cause and effect information. But what they can do is help us record what is happening, and they can help us study routes of exposure. And case studies are a really good way to start to study changes in health. For example, case studies were the first step in our understanding of AIDS and HIV. Okay, so we interviewed owners in 8 states so far across the country. Most of our cases are right here in Pennsylvania. And we obtained information in 3 broad categories. And the first category was drilling information. And what we collected first with the drilling was dates of drilling, completion, processing, and production. We also obtained locations of gas and injection wells, impoundments, compressor stations, pipelines, processing stations. We got that information. The next category of information we got was environmental test results. So air, water, soil test results. The third set of information was health records, both human and veterinary. We also asked for permission to speak to health professionals involved with the case whenever possible. I'd like to just take a second and talk about the health records for a moment, because I'm hoping that many of you out there are health professionals. So if any of you who are out there who are health professionals are practicing in areas that are being actively drilled, I'm hoping that your intake form reflects that. I'm hoping that somewhere on your intake form, you're asking your patients, do you live near a gas well? Because what that will do for you will be to open up a line of communication on a health issue with people, and by people I mean doctors and patients too, who might otherwise be reluctant to talk about that. And I'm hoping that wherever Diane is right here, that maybe we can pick up on that thread with the panelists or in questions and answers, because that's another whole lecture in itself. Getting back to our study here, what did we do with those 3 blocks of information? What we did was created a timeline. And we went out 5 years before drilling. So on our timeline, we could see all of that data, and we've got a snapshot of health before and after. And from that timeline, we could then get exposures. We could then determine routes of exposures. Okay, so this is how we lumped our exposures with drilling stages. So we've got drilling at the top, hydraulic fracturing going around clockwise, and then wastewater and processing and production. In the center are the species that we studied. So many of you recognize it. At any rate, overall, we look at this, we can say that many of our cases had more than one route of exposure. The next thing that we can say broadly is that approximately 3/4 of our cases fell into the drilling and hydraulic fracturing, especially with well and spring water that was affected following drilling and or hydraulic fracturing. So that was a large number of our cases had those exposures. We go around to wastewater, approximately 1/3 of our cases fell into that group of exposures. And then the processing and production and air quality issues were another 1/3 of our cases. Okay, so next I'm going to talk about a few of our cases. This is the first one that grabbed my attention. This took place in early spring in Louisiana in 2009. It is well documented by the Department of Environmental Quality in Louisiana. This was a case where 17 previously healthy cattle, and when I say previously healthy, I spoke with the veterinarian on this case, and he assured me that these cattle were healthy, but they died within an hour of exposure to this hydraulic fracturing fluid. Those are actual pictures from that event. Okay, so one of the cows, they were watching these cows die, and they decided, hey, let's get them in for a necropsy, or an animal autopsy. Those were the symptoms that they saw in the cow. The driver noted as he was bringing the cow in to necropsy. The cow died en route. A necropsy was done, and the most likely cause of death, as reported on the final necropsy report, was respiratory failure with circulatory collapse. Now, petroleum hydrocarbons were found in the small intestines, but there were lesions in the trachea, lung, liver, and kidneys that indicated the presence of toxins. Okay, so tetramethylammonium is a quat, or a quaternary ammonium compound that's highly toxic. That was present in the hydraulic fracturing fluid that these cows were exposed to. That compound could very well have caused those symptoms and the lesions that were reported on that necropsy report. Okay, the next cases I want to talk about are our natural control and experimental groups. When we first started to study this, we didn't expect that we would have the opportunity to have something close to a control. But farmers oftentimes keep their cattle on different pastures. So that allowed us to look at cases like this. So in the first case there, it was a beef herd that was exposed to wastewater after the liner was allegedly slit, according to the farmers. The wastewater ran down the path, the impoundment was up higher, ran off the impoundment, down into the pasture where the cattle were, and into the pond, which was their source of water. That farmer had a number of cattle die acutely within 1 to 3 days, but he also had a high incidence of stillborn and stunted calves. He had another part of this herd on another pasture. They were not exposed to the wastewater. They had no unusual change in health. Okay, the next case is also a beef herd. This farmer had actually 3 different places he kept his herd. One of the places was along a creek where, again, allegedly wastewater was being dumped. What happened with this is, again, some acute deaths. In this case, with reproductive problems, it was failure to breed back the following spring. He had a very high number of cows that failed to breed back. His other herd, the herd that was on the other 2 pastures, no change in health. The final case is a dairy herd that was exposed to affected well water after casing failure. Okay, so cement or casing failure. The well water was severely affected. In that case, again, the herd was separated. He had reproductive problems, which were very general, some abortions, stillbirths, failure to breed, and failure to cycle. But he also noted other problems, lameness, mastitis, and a drop in milk production. The herd that was on the part of the pasture, not drinking the well water, they were actually drinking pond water, no change in health. These are the only 3 that we've had so far like this. I'm sure there are more out there. Okay, so our results. The first thing I'm going to talk about, actually I'm going to just talk about it briefly because Robert's going to pick up in just a few minutes when he starts talking again. We found it very, very difficult to find definitive links. The closest thing that we have to a definitive link is that case I showed you initially with those cows in Louisiana. That's as close as I got. I had doors shut on me when I tried to go further to find out what they found, and I'll talk about that in a minute. So why is that? That's for in my mind, 3 or 4 reasons, and Robert will go over those again in more detail. But one is we don't know exactly what all the chemicals are that are being used with drilling and hydraulic fracturing. We hear that a lot, and that is true. Second thing is that we don't know what the interactions are. Third thing is we don't have complete testing. And fourth thing is the thing I alluded to earlier is non-disclosure agreements. Because of non-disclosure agreements, complete health information is not available. I'll just go through quickly what we found, because I just have a few minutes left, when we look at that timeline, again, we're comparing health changes, both food animals and companion animals. The big problem was reproduction. And with humans, it was the problems noted there, very, very common problems we had reported with people. Okay, so I've got 2 more slides. They're both on food safety. I just want to say that only one of our herds was quarantined. Only one was quarantined, but all of them were exposed to affected water, air, or soil. So no testing done, still producing food products. And this opens up these questions. And these are the questions we receive most from the public. People will email and call us. This is what they want to know. How safe is my food going to be from farms where known exposures have occurred, as well as farms downstream and down into those farms? And how safe is the rendered flesh from cattle that have been exposed, keeping in mind that that rendered flesh is used to feed chickens and pigs and can still work into our food supply that way, even if you don't eat red meat. Excuse me. So the answer is, the big answer is that we don't know. I think Walter said we were going to raise more questions. So why don't we know? In this country, there is inadequate funding for food safety research specifically related to chemical contamination. And that's a fact. And if we had a lot more funding, we might be able to answer those questions. The other 2 issues are, we're not doing any testing right now, pre and post slaughter or pre and post harvest for crops for these sort of contaminants. Okay? And you know, those are really important issues. But there's also the fact that we have no experimentally determined hold times on many chemicals used for drilling and fracturing. Hold time is the amount of time that an animal is held back from slaughter after exposure to a chemical. The chemical could be an antibiotic, a drug that a veterinarian might prescribe. It could be a pesticide, or it could be any one of these chemicals that are used in drilling and fracturing. And until we have the answers to those questions, the public health is at risk over both the short and the long term. Okay, I'm going to hand it back over to Robert. He's going to fill you in on a lot of these